Hi, I'm Jessica,
And I'm Tracy,
and this is She's on Top, the place where we celebrate and elevate women.
and this is our series called The New Normal.
And today we are hanging out with Christine McNab. Hi, Christine.
Hi.
So I'm going to, it's funny because Christine and I met through a mutual friend, and I'm embarrassed to say until I looked at your website, I had no idea of the amazing career that you've had. So I'm going to do a little intro, but then I'll let you kind of take it from there. So you were, you got a degree in journalism, and you were a journalist. You did photojournalism, and you were a journalist for CBC. And then you got your master's in Switzerland in what was it? Master's in international relations. And you've been working with the World Health Organization. Is that what you're still doing? Can you go from there?
Yeah, sure. No, I left WHO, at least the staff position there, back in 2008. And since then I've been consulting pretty much for, well, how long has it been? So several years now, doing a lot of communications strategic work and doing a lot of moving more towards multimedia storytelling. So for the last few years, I've been especially interested in kind of picking up my journalism roots again, in a sense, doing a lot of photography, making videos, and trying to tell stories mainly in global public health. So my clients are, WHO is one of the major ones, Unicef, the Gates Foundation, the UN Foundation, etc. So I'm still working in that sort of global public health realm most of the time.
Yeah, well, I looked at your website. It's fantastic, and you're working a lot with polio. It said on the website that I was looking at.
Yeah, no, I've done a lot of work in polio eradication. I wish it was eradicated. That was actually my first job at WHO, was working in the polio eradication unit.
Was that with Bill Gates? Because that's his focus, right?
Yeah. Gates came in a little bit later. I started in 2000, and by around 2004, the Gates Foundation had come in quite heavily. And I did a lot of work on polio in Nigeria, working with the Gates Foundation there. Right. So now we're down to what, 2 countries. And I think right now, unfortunately, the COVID pandemic has actually ended polio eradication activities. So I think we're all a bit worried that as this one goes on, we're going to see a new resurgence of polio, especially in these countries that are left, Pakistan, Afghanistan. But fingers crossed, yeah.
What's your, and I noticed also you've worked with SARS, and so what is your take on this, Christine? Did you see this coming? Is it hit harder than you thought? Is this your sort of more personal experience of it?
I felt, when it first started, I really felt it was going to be more like SARS, and SARS was, the main difference, it turned out, which we didn't know until a little bit later, was that SARS, you knew someone had SARS because they had really severe symptoms. So because of that, you could find the disease quickly, you could isolate the person quickly. There weren't that many cases ultimately of SARS compared to what we're seeing today. So you could also trace all the people that person had been in touch with, and you could isolate them. So we actually, stopped SARS entirely. The disease essentially disappeared after 2004. The difference here is that asymptomatic people, it seems to spread from person to person more easily. And it's spread now all around the world. So 3 months ago, I thought, well, this might be like SARS. China's pretty good at containing these things now. I thought this one had been kind of back in the box. So I was very wrong. When this first came, I was much more optimistic, frankly, then.
Right. And so how has this affected you personally with your work with the WHO, with other companies? How has this affected you?
Yeah, it's been one of my contracts earlier this year. I was meant to be coordinating a series of stories about nurses and midwives. It's the year of the nurse and midwife, which is a bit of a sad irony given we're supposed to be celebrating sort of lots of the types of work they do, but now we're really, this is really underscoring how critical they are. But my job was going to be to hire photographers, videographers around the world and go myself on a trip or two to do personal profiles of nurses and midwives. And about 4 days before I was supposed to do one in Uganda all of a sudden had a case, and they shut down very, very quickly. So the ethics of whether I could send a photographer to meet with the nurse or midwife in person, it became clear that it became impossible. I still had to do a video for the year of the nurse and midwife World Health Day, which was last week. So I had to do what we're doing now. And basically I put out a call through a partner organization, Nursing Now. They asked for nurses and midwives to write to me if they would tell a bit of their story about how they were managing during COVID-19. And I got calls or emails from all over the world, and ended up doing pretty quickly about 30 interviews over the course of about 3 days. And then turned that video, turned those videos into a 2-minute video, you know, compressed a lot of their stories to kind of tell a global story. And here in Toronto, I was lucky. I mean, I felt terrible for a lot of the independent editors, graphics people, you know, generally people who work in the industry, called people out to help because I had so much video to look through, etc. And within seconds, I had a whole crew, you know, assembled because people needed the work. So it was great to be able to have a project where I could sort of pivot and offer work, but I'll, you know, tell the story of these nurses and midwives. And WHO released the video last week, and it's been seen something like 2 million times. So
wow, where did we find it?
Oh, I'll send you the links. Yeah.
Yay,
That would be
perfect.
fantastic.
Okay.
Well, we'll put it in the description of this video so people
that'd be
can
great.
watch it. It sounds amazing.
Fantastic.
Yeah.
Great.
We
great.
it's interesting because one of our ambassadors we were talking to last week was saying that she has a friend who's a midwife, and she was scrambling and running around trying to help her to get PPE because she was going to people's homes and doing this and didn't have the right equipment. Is that something that they were saying?
All of them. I mean, that was the amazing thing when I talked to people in Nigeria and Bangladesh, in Cambodia, in South Africa, in Mexico, in Spain and Italy. And that was the major preoccupation for a lot of people, was just the lack of basic safety masks, the N95s that are now so famous, of masks, of screens, of gowns. So some countries, you know, where there'd been very little virus, like Bangladesh, they felt pretty prepared, and they had more time maybe to prepare. India as well. But they also knew they'd be facing shortages, and there is just a global shortage now. There's just not enough of these materials in the world. I know lots of people are working hard to change that, but it was a common theme globally, which it's urgent. You know, where like somebody had said, we're sending people to the front lines with no armor, and we need to respond. And again, there's been good response. Everyone recognizes it, but it was a shame some countries didn't spend more time purchasing and preparing while they had time. But there you go. Lots of lessons that we're going to learn from this one.
Sure.
Yeah.
Do you have any like what's your feeling about it all? Like, what's your feeling now that you're in it and you've been experiencing it? Are you thinking, I mean, nobody has a crystal ball, but I don't know, maybe, you know what, maybe I should switch topics. Like, how are you dealing with it? What are you feeling personally? You know, because I think, like you said, you know, we've all been dealing with this for 4 or 5 weeks. How are you finding it?
Yeah, up and down. Like the very beginning, it was hard because I really wanted to be part of the response. Like I was writing to WHO saying, you know, I'm available if I can help. And they were sort of saying, believe me, you don't want to be involved in this, in a sense. I mean, that was a bit tongue in cheek, but they're moving so quickly too that it becomes difficult to involve people in other places because they're working so hard. And so for a couple of weeks, and I was trying to struggle, how can I do this video project? Is it going to happen? So that was hard. I wanted to be part of something, and it was hard to find a place, I think. And once we realized we could do this nurses video dynamically through Zoom, that was very energizing. And, you know, I was up night and day doing interviews, you know, early in the morning to talk to people in Bangladesh and whatnot. And that was really motivating. And then I was very motivated to get their voices out. Like, these people have to be heard. I had, you know, poor quality interviews from a couple of African countries, Nigeria, for example. And, you know, in a different world, you might just go, well, let's just cut those bits out because you can't see and you can't hear very well. But I thought these people made time to talk to me. They are doing the best they can to get their message out. And I felt really strongly, you know, we had to keep those voices. So that was important. And now pivoting again, trying to figure out how to do more of these videos. If we're going to do more of these sort of Zoom style videos. I found a midwife in Iran who I've been communicating with, who's absolutely amazing. And you should go on her Instagram. You might put that out too. But, you know, Iran's had a huge outbreak, and she's been trying to manage her work. And she's still birthing babies like daily. And she puts some amazing photographs, just, you know, babies who are just born with these very happy mothers and fathers. And that's been very motivating to watch that too, and see how I can figure out, maybe because she's so good at her own, taking videos, taking photos of her work, maybe we can work with her to kind of, she can create her own video. So we'll see. So staying, you know, certainly motivated by the potential, I think, to keep telling these stories.
That sounds fantastic. And one thing we're asking everybody we're interviewing is there anything we can do as a community to help? I mean, you're talking to people from all around the world. How can we help you?
Oh, that's nice. No, I think, you know, it's it's sharing these videos. Not that it's about my video, but it's about, again, it's about these voices. I think ensuring that we keep getting correct information out there, you know, that we do the best we can to dispel myths, that we send people to websites that are trustworthy, Public Health Agency of Canada, to the WHO website. You know, there's controversies. People are pushing back now too, because people are tired. People are frustrated, anxious, there's blame going around, but I still feel strongly that those agencies are the source of our best information. And I think if we all can play a role in ensuring people have good information is really important. And if you know a nurse or midwife or, you know, people who clean the hallways at the hospitals, the orderlies, people who don't get paid very much. There's programs now around Canada, we can, you know, buy restaurant meals for them, send them their way, buy a gift certificate if it's Tim Hortons or Starbucks or whatever it is, and get them a free coffee. You know, there's ways we can support people locally as well.
Well, we'll definitely get all that information for you and put up all the links. Do you have anything, we're asking people to, anything that you've learned from this, or any kind of, yeah, like, you know, where are you at, sort of, what are you thinking about all this, like in terms of lessons we've learned, whatever? We're just curious.
Oh, I guess there's, you know, lessons are probably, I'm sure other people say the same thing around, you know, how can we conduct business in different ways in the future? How can we fly less to meetings? My work involves a lot of flying, and I've been feeling increasingly guilty about that. You know, maybe I have to give some of that up. I'm really loving the resilience in communities, you know, that we're seeing, that we're helping our neighbors, that we're shopping for people, that we're being stronger, I think, as communities, supporting local business, supporting local restaurants, and other business the best we can. So that's a really bright light, isn't it? That we see how much we want to help each other out. And I do hope that continues, you know, because there'll be lots of people too who are really left out of this, and may not be in community as strongly. And maybe how do we find those people too and ensure that they're feeling all right. Like yesterday I was walking by myself on the 10th and saw, it was really tragic. It was, you know, Sunday, it's Easter Sunday. He was really fellow in rough shape, walking along, asking for change, you know, and there was nowhere he was going to be able to spend it, particularly because most everything was closed. I didn't have any money in my pockets. If I had some, I would have certainly given him some, you know, but how do we ensure that they remain feeling part of life and part of community as well?
It's such a good point that my mom told me a story the other day. I think people kind of disconnect, and I kind of had to even sort of, you know, she said that, you know, a man had come into the store. He's obviously somebody was asking for money, went to pay for something, and the store said, sorry, we don't take money, because everybody's using plastic. And I was like, you know, and I was like, it's just a reminder to everybody, if you see that, you know, like pay for it for them.
Right. Yeah.
You know, like, because that, I never even thought that's a second way to struggle. First of all, people aren't carrying money. And then these people can't pay for things with money anymore. So there's so many levels that you don't really realize as we get into this kind of protective world.
Yeah, no, exactly. And we've seen in Toronto some cases of COVID in, you know, homeless shelters, et cetera. And so we're paying attention, I think, to the people working in the grocery shops, the delivery drivers, et cetera. But there are people, again, particularly people who have nowhere to live, who need our support, I think, too.
Yeah.
Yeah, well, thank you very much for talking to us. If you can send us all the links to your video, to maybe even to organizations you think would be really good for us to connect with, and let who's ever watching this connect with too, that'd be fantastic. And we really appreciate your time. Thank you for talking with us.
Thank you for inviting me. It's great to talk to you both.
Thanks so much, and stay safe.
You too. You too.
Okay. Take care. Bye.
Bye.
Bye.